am Susanna Smith, and I am currently a senior at The Ohio State University in HTHRHSC 4370. I'm currently here to talk to you about the differences between Finland and the United States in relation to healthcare and other factors. The first thing I would like to mention are the different types of healthcare that each country has. According to Finland Health, Finland is a universally publicly funded healthcare system. This means that every citizen of Finland is entitled to insurance. The government picks it all up. However, in the United States, the Department for Professional Employees defines that our health system is kind of a hybrid system. That really means that it's not fully privately funded and it's not fully publicly funded. That means there's opportunities for citizens to self-pay for their healthcare, just paying out of pocket, or getting government assistance, or receiving insurance from your employer. The first thing I decided to compare between the two countries was the infant mortality rate. A little side note on why I chose this is I used to work in obstetrics and gynecology, and I've delivered my fair share of babies. And I wanted to see what the difference was between the two countries. I found that according to the Central Intelligence Agency's World Factbook, Finland has on average a total about 2.5 deaths per 1,000 live births. Whereas unfortunately in the United States, we have an average of 5.8 deaths per 1,000 live births. This could be due to the fact that our babies, sleep in cribs and they have blankets that they can suffocate on. Or it could be due to the fact that Finland's babies, they all go home in a little cardboard box and that's where they sleep for a couple months. The next thing I decided to compare was the total healthcare spending per capita between the two countries. This looks at their gross domestic product. The Encyclopedia Britannica defines gross domestic product as the total market value of goods and services as provided by a country's economy during a specified period of time. You can calculate this by adding the country's consumption, investment, government spending, and net imports. This information is really useful because the country's gross domestic product is used all across the globe as the main measure of output in economic activity. So in the CIA's World Factbook, they found that in 2014, the total amount of gross domestic product, or GDP, spent by Finland on healthcare was 9.7%. What's really crazy is even though this country pays for all of its citizens' healthcare, it spent way less than the US, because in 2014, the US spent 17.1% of their total GDP on healthcare services. The next statistic I researched was annual compliance with the influenza vaccination. I wanted to know if there was an actual difference between people in Finland, where their insurance is pays for their vaccinations, or people over here in the US, where not all of us get that kind of system. According to the National Institute for Health and Welfare in Finland, 31% of Finnish children between the ages of 6 to 35 months received the flu vaccination in between 2017 and 2018. And the Finnish senior citizens 65 and older, about 47% of them received their vaccinations. In comparison, the Centers for Disease Control and Prevention released that children in the United States between the ages of 6 months to 17 years old had a compliance rate of 47.8% of people getting their flu shots in the last 12 months. They also found that our senior citizens in the US between the ages of 65 and older had a 67.8% compliance rate. The fifth thing I decided I wanted to research about between the two countries was the actual percentage of children in each country that received the recommended vaccinations, just due to the fact that there are so many anti-vaxxer parents out there currently at this moment. In Finland, they actually sort of require their children to have vaccinations, and you can see that in their statistics. According to the National Institute for Health and Welfare, Finnish children between the ages of 19 and 35 months received at least 90% of compliance rates in the DTaP, MMR, rotavirus, and pneumococcal vaccinations. However, the same stats aren't really shown in the US because according to the CDC, there was only at least a 90% of a vaccination compliance rate in children receiving the hepatitis B vaccination, the chickenpox vaccination, an MMR vaccination, polio vaccinations, and the HIV vaccination, which is a hemophilus influenza type B shot. However, unfortunately, there was less of a compliance with US children in receiving the DTaP, pneumococcal, and a combined 7 vaccine series. You had at least 70% of children, so not a whole lot missing, but you have at least 30% of the population not receiving some vaccinations. The one thing that concerned me after the Flint water crisis was whether or not each country was able to provide their populations with safe drinking conditions. I wanted to figure out if there was an actual difference between the water in Finland and the water in the US. According to the CIA's World Factbook, Finland actually has 100% of their rural and urban areas all having improved safe water for their populations. Yet again, unfortunately, the US falls very short. We have, as of 2018, only 99.4% of urban areas have safe drinking water, and only 98.2% of rural areas have safe drinking water. These still sound like high percentages, but unfortunately, you still have 0.6% of urban populations and 1.8% of rural populations in the US that do not have safe drinking water. The seventh thing I decided to compare between the two countries was their access to healthcare. I wanted to see just how many physicians there were in comparison to the amount of people in the country. I decided to look at just primary care physicians and how many of them were actually able to be per person, per patient. The CIA's World Factbook showed that in 2014, Finland only had 3.2 physicians per 1,000 people, or 0.0032 physicians per 100,000 people. Closely behind, and not very far off, was the United States, that in the same year, they had an average of 2.57 physicians per 1,000 people, or 0.00257 physicians per 100,000 people in 2014. If you look at both of these numbers, it's scary to think that there's so few doctors per so many people. The last comparison I decided to make between Finland and the United States was to compare the teenage birth rates. According to the World Bank, Finland has on average 6.9 births per 1,000 women between the ages of 15 and 19. That equates to about 0.00690 births per 100,000 women between the ages of 15 and 19. Unfortunately, yet again, we're on the higher end of this spectrum, and the United States was shown to have 0.61 births per 1,000 women between the ages of 15 and 19, which equates to about 0.2061 births per 100,000 women between the ages of 15 and 19 in 2016. In conclusion, I found that since Finland has most of its healthcare paid for by the government, they have a higher utilization of vaccinations and other healthcare services, though at maybe a longer wait time in comparison to the United States. Even with the country paying for all of its citizens' healthcare, Finland only pays 9.7% of its average yearly GDP, where we in the United States still pay 17.1%. That's almost double what Finland's paying. Overall, Finland has a higher compliance and lower birth rates for teenagers and a lower infant mortality. They also have a cleaner water supply and safer water supply for their population. Whereas the only thing I could find that the US actually succeeded at in difference was actual compliance on flu shots. Thank you very much.